Hello, my name is Mary Getty, and today I'm here to talk to you about Hashimoto's disease. So, what actually is Hashimoto's disease? Well, first of all, Hashimoto's disease is known by several other names as well. These include Hashimoto's thyroiditis, chronic lymphocytic thyroiditis, and autoimmune thyroiditis. Thyroiditis is when your thyroid gland becomes irritated. Hashimoto's thyroiditis is the most common type of this health problem. It's an autoimmune disease that occurs when your body makes anti-thyroid antibodies that then attack the cells in your thyroid. The thyroid then can't make enough of the thyroid hormones. Many people with this problem have an underreactive thyroid gland because the thyroid itself is being destroyed, and this can also be known as hypothyroidism. Most often they have to take a medication to keep their thyroid hormone levels normal. Hashimoto's thyroiditis is an autoimmune disorder. Normally, your autoimmune system protects your body by attacking viruses and bacteria, but with this disease, your immune system attacks your thyroid gland by mistake. Your thyroid then can't make enough thyroid hormone, so your body can't work as well. So, who actually gets Hashimoto's disease? Well, it's important to first note that the exact number of cases is not known. About 5% of the US has been diagnosed with hypothyroidism, but there are causes other than Hashimoto's which can cause this, and the exact cause of Hashimoto's is unknown. Hashimoto's has been observed about 4 to 10 times more often in women than men, and although the disease may occur in teens or young women, it more often develops in women aged about 30 to 50. Your chance of developing Hashimoto's increases if other members of your family have the disease. There is a very clear genetic factor involved. You are also more likely to develop Hashimoto's if you have other autoimmune disorders. This includes celiac disease, a digestive disorder that damages the small intestine, lupus, a chronic long-term disorder that can affect many parts of the body, rheumatoid arthritis, which affects the joints, and type 1 diabetes, which occurs when your blood glucose is too high. So, what are some complications that can occur with Hashimoto's? It's important to note that many people with Hashimoto's develop hypothyroidism, and it's this untreated hypothyroidism that can lead to these health problems. This includes high cholesterol, heart disease and heart failure, high blood pressure, mixed edema, which is a rare condition in which the body's functions slow down to the point where it can actually be life-threatening. And then left untreated, hypothyroidism can also cause problems during pregnancy. So depending on your iodine levels, sometimes even an infant can have secondhand goiter from the mother. So what are some of the symptoms? Well, it's important to note that many people with Hashimoto's have no symptoms at first. It's as the disease progresses that you have many of these symptoms, or maybe just one. Some of the most common symptoms include fatigue, weight gain, trouble tolerating the cold, joint and muscle pain, constipation, dry skin or dry thinning hair, heavy or irregular menstrual periods or fertility problems, a slowed heart rate, and a goiter. So this is when your thyroid may become enlarged and cause the front of the neck to look swollen. The enlarged thyroid, called a goiter, may create a feeling of fullness in your throat, though it's generally not painful. And after many years, because of all the damage that can occur to the thyroid, the gland can actually shrink, causing the goiter to disappear. So that inflammation is what causes that enlargement. It's important to note that Hashimoto's disease causes hypothyroidism most often, however, rarely, early in the course of the disease, thyroid damage may lead to the release of too much thyroid hormone into your blood, causing symptoms of hyperthyroidism. When your thyroid doesn't make enough of the hormone, the symptoms are more along the lines of that tiredness, muscle weakness, weight gain, cold, depression, and hair and skin changes. However, during the other phase, when the thyroid is releasing that extra thyroid hormone, this is called hashitoxicosis. This does not happen to everybody, but during this phase specifically, it's being hot that bothers you. You might have a rapid heart rate, you might have sweating, weight loss, tremors, and severe anxiety. So, how does Hashimoto's affect the actual hormone production? Well, the thyroid gland makes two primary hormones, thyroxine, T4, and triiodothyronine, T3. Two brain structures, the pituitary gland and the hypothalamus, regulate these hormones released by the thyroid gland. The following steps are how this occurs. So first, the chain of command begins at the hypothalamus, spot in the brain, which then prompts the pituitary gland to make a chemical called thyroid stimulating hormone, or TSH. The pituitary gland checks the amount of T4 and T3 in the blood, and then releases TSH if the T4 and T3 levels need to be topped up. Then the thyroid gland tries to secrete T4 and T3 depending on which order it receives from the pituitary gland. Generally speaking, the more TSH the thyroid receives, the more T4 and T3 it secretes. The pituitary gland may order the thyroid to make more T4 and T3, but in the case of Hashimoto's disease, the thyroid gland can't deliver. The immune system has created antibodies that attack the thyroid tissue, and the thyroid becomes inflamed. This condition is called thyroiditis, and the thyroid cells become permanently damaged, which hampers the thyroid's ability to make T4 and T3. In response, the pituitary gland secretes more and more TSH, but still the thyroid can't keep up. The thyroid then may enlarge, forming a goiter as it attempts to obey the pituitary gland, but can't actually deliver. So what actually causes Hashimoto's? Well, researchers don't actually know why some people develop Hashimoto's disease. However, a family history of thyroid disease is common, and several other factors may play a role, including the aforementioned genes, and then viruses, such as hepatitis C. Hypothyroidism can also be caused by some medications that are often used to treat bipolar disorder or other mental health problems. Iodine-containing medicines used to treat abnormal heart rhythm, and exposure to toxins like nuclear radiation. So, how do we diagnose Hashimoto's disease? Well, there's two primary components. The first is a medical history and a physical exam. Your doctor will start by taking a medical history and performing a physical exam. In addition to talking about symptoms, the doctor will check your neck for goiter. Again, that's that enlarged thyroid, which some people with Hashimoto's disease can develop, though not always. Your doctor will also likely use blood tests to check for hypothyroidism and maybe a specific cause. Examples include tests for thyroid stimulating hormone, TSH. A high TSH level most commonly means that the thyroid gland is not producing enough T4 hormone. This lab is usually most consistent with a diagnosis of hypothyroidism or subclinical hypothyroidism. They might also do a free T4 check, or free T4 test. A low T4 level suggests that the person has hypothyroidism, and they also might do an antithyroid antibody test. So they're checking there for those antibodies that would then attack the thyroid. More of these antibodies indicate a higher risk of developing Hashimoto's hypothyroidism. You probably won't need other tests to confirm that you have Hashimoto's. However, if your doctor suspects Hashimoto's disease, but you don't have antithyroid antibodies in your blood, you may have an ultrasound of your thyroid. This ultrasound images can show the size of your thyroid and other features of Hashimoto's disease. It can also rule out other causes of an enlarged thyroid, such as thyroid nodules, small lumps in the thyroid gland. So treatment. How do we actually treat Hashimoto's disease? Well, it's important to note that our treatment depends on whether the thyroid is damaged enough to actually cause hypothyroidism. You can have Hashimoto's with the body producing these antithyroid antibodies, but until the damage gets to a point where it's causing hypothyroidism, your doctor may choose to simply check your symptoms and thyroid hormone levels regularly. However, you also might be prescribed the medicine levothyroxine. This medication is identical to the natural thyroid hormone thyroxine, T4, and is the recommended way to treat most kinds of hypothyroidism. It's been prescribed in pill form for many years and now is available as a liquid and soft gel. And these newer versions might be helpful for people with digestive problems that might affect how the thyroid hormones are absorbed. Some foods and supplements can also affect how well your body absorbs this medication. Examples include grapefruit juice, espresso, soy, and iron or calcium containing multivitamins. So some doctors might recommend that you take this on an empty stomach to help prevent any kind of odd interactions. So maybe in the morning, 30 to 60 minutes before you eat your first meal. Your doctor will give you a blood test about 6 to 8 weeks after you begin taking this medicine and would adjust your dose as needed. So keep in mind that this is just giving your body that thyroid hormone that the thyroid is no longer producing in sufficient quantities. Each time after you change your dose, you'll have another blood test. And then once you've reached a dose that's working for you, your doctor will likely repeat that blood test in 6 months and then once a year. Your hypothyroidism can be well controlled with that thyroid hormone as medicine, as long as you take it as instructed by your doctor and have the regular follow-up blood tests. It's also important to note that the thyroid uses iodine, a mineral found in some foods, to make thyroid hormones. However, if you have Hashimoto's disease or other types of autoimmune thyroid disorders, you might be sensitive to some of its more harmful side effects. So foods such as kelp, or other kinds of seaweed and other kinds of iodine-rich medicines may cause that hypothyroidism or make it actually worse. So for that reason, you're also not recommended to take iodine supplements. However, if you're pregnant, you need to take enough iodine to make sure that your baby gets enough from your diet. Too much, but again, you want to be careful not to take too much, as it can actually cause a goiter in the baby. So if you're pregnant, be sure to talk with your doctor and very carefully watch those iodine levels. So overall, we can treat the loss of thyroid hormone that is caused by the Hashimoto's, but in regards to the specific capture or prevention of the anti-thyroid antibodies, we really don't have any viable treatments right now. It is pretty mostly just this levothyroxine. However, it has been used for a long time with very minimal complaints and very high effectiveness. And here are my sources. Thank you all for watching. Have a great day and feel free to reach out if you have any questions.